Hi everyone, my name's Dylan. I'm one of the sort of young champions and I'm from East Sussex.
I'm Kim from Baines.
Nice, and we are on stop 3 of our benchmarking forum tour about the survey. This time we're talking about access to health and mental health. Okay, so over to you, Kim.
Oh yeah. 75% of the people that took part in the survey said that the cost of living crisis has had an impact on their mental health. That's done.
Okay, brilliant. Okay, so moving on to the next question. So how easy is it for care experienced people to get the mental health support that they need? 62% of care experienced people found it difficult. Oh, I'm not close enough to the mic. Oh, am I fine? Okay, cool. All right, found it difficult to get the mental health support that they needed. That is a very high percentage. That's quite worrying. And only 24% found it easy to get the support they needed. So YPBMF said this doesn't surprise us. It's very difficult to access support, and care experienced people need a specialised approach as we don't fit into general services, which makes it harder.
1/3 of care experienced young people felt that their PAs didn't have the appropriate training to help them. Yeah, that's all I said.
Okie dokie. Okay, so moving on to the next one. Okay, so are you neurodivergent? So for example, dyslexia, ADHD, autism. Obviously there's a lot of other conditions that also can be included in that term as well. So a high proportion of care experienced young people identify as being neurodivergent, with 31% having a diagnosis for it, but 35% they think they might be, but they don't have a diagnosis as well. And we'll be talking about sort of the assessment process, how easy it is to have that in a second.
A lot of young people find it difficult to get an assessment for ADHD and autism, etc. Oh.
Should you go on for a bit longer so I can have a read? Okay, all right. A few seconds. Cool, all right, so moving on to the next. Oh, I've gone too far. Oh, I think it was that one there. So is it easy to get support around neurodiversity? So yeah, so going from the previous one, even if you are able to get a diagnosis, quite a high percentage of young people still find it difficult to gain support. You can see sort of there, 11% of people actually found it easy to gain support once they had sort of got a sort of, I think actually, to gain support for any reason. Yeah, so it's just about support, yes. Okay, moving on.
How easy is it to find and get an appointment at the following dentist, doctor, or optician? As you can see on the slide, young people find it difficult to get appointments with key health services. There we go.
Thank you very much. Okay. So, as for the support that young people have received that is helpful, we have got gym memberships as the most frequent response, free prescriptions for medication, which is brilliant, and mental health workers at the Care Leavers Hub. And also providing resources to help young people understand their mental health and feel empowered. But also sort of other ones that maybe weren't as helpful. So young people sort of felt that they should make sure the therapy offer is right. So for example, CBT or cognitive behavior therapy, art therapy, etc. isn't right for everyone. And gym memberships are not available or accessible to all.
Care experienced views and experiences. Mental health, care leavers, nurse. We need more of those. Community health, mental health services are god-awful. That really needs looking at. I recently had a mental health support request denied because I had enough support. PA support and living in supported accommodation should not prevent you from getting the mental health referral. And breathe. I need the opportunity to get assessed for ADHD and autism. I struggle so much. I get labelled as having anxiety and lazy with depression, but I genuinely can't focus.
Thank you very much. Okay, so as for the question about what can help you to improve your health and mental health, so I've just got to sort of quickly read through these points. So we've got firstly access to assessments and support for neurodiversity. So providing information about the process of diagnosis, right to choose, and ways to fast-track care experienced individuals would be quite helpful, the survey found. And also helping to get outside in nature, so leaving care teams or youth groups offering activities such as walking, gardening in allotments, or running groups would be really helpful. And just to sort of add as an extra sort of add a bit of detail, a bit of context, for my undergraduate degree I studied neuroscience, and I've read hundreds, if not thousands, of very boring scientific research papers saying that going outside is incredibly important for your mental health. It just boosts it immediately after you go outside, and it's brilliant. So that is a very sort of one that I'm very passionate about. Next one, we've got out-of-hours support. So mental health is not a Monday to Friday 9 to 5 problem. It happens all the time. Have flexible out-of-hours support, such as Ask Jan from the Reese Foundation, which is brilliant, and care leavers hubs can also help. And lastly, reducing isolation, because social isolation, it's not fun. So creating opportunities and providing support for individuals to meet with others, share problems, have fun, and feel healthier would be really beneficial. Okay.
Care experience views and experiences. My personal advisor went on a course to study borderline personality disorder to better help me. She did it in her own space and time and out of her own money. There we go.
Thank you very much. Okay, so what should local authorities do? Here are some points. Mental health and health training. So leaving care teams benefit from having specialists within the team, but all PAs should have mental health training and be trauma-informed. Just to sort of recap that sort of very famous Tony Blair statement that I'm very passionate about. Education, education, education. If people are informed, they can make better decisions and actually help the young people in their community. Out-of-hours support. Finding solutions for out-of-hours support, such as commissioning voluntary organisations, care leavers hubs with crisis support, and apps, e.g. Kooth and Ask Jan. And next one, health and mental health specialists within care leavers teams. Having mental health workers, leaving care nurses who are accessible at care leavers hubs would be really beneficial. And creating and promoting groups and activities, so which will help to reduce isolation and get care experienced people involved in positive activities and communities. And lastly, over to you.
National asks, neurodiversity research. Fund national research into neurodiversity and care experience to get an idea of the scale of the issue and how to support individuals approximately to thrive in work, education, and life in general. That's one down. National offer around health. Ensure that local authorities and organisations are providing good health offer in their areas. For example, gym memberships, free NHS prescriptions in all areas. Breathe. Address the dental health crisis. Care experienced young people cannot get NHS dental health care and cannot afford private dental care. They can be left in I don't even know what that word is.
Deliberating.
Yeah.
Oh no, debilitating, sorry.
Pain, which impacts on work, education, and standard of life. Specialised mental health support. Care experienced individuals often require mental health interventions, which that's just it. That's it.
Okay, well, that is everything for our topic. So we'll go on to the next one now. Thank you very much.